Today's nursing mindset is about gas exchange. When you hear the term gas exchange, it's easy to think only about the lungs. But as nurses, we think much bigger than that. The question we should always be asking is oxygen getting into the body? And is carbon dioxide getting out? Because if either part of that process breaks down, every organ and eventually every cell can be affected. Let's begin with the three processes that make gas exchange possible. The first is ventilation. Ventilation is simply the movement of air into and out of the lungs. When we inhale, the diaphragm contracts and moves downward, allowing the lungs to expand and fill with oxygen-rich air. When we exhale, the diaphragm relaxes and moves upward, pushing carbon dioxide out of the lungs. Ventilation moves the air, but by itself doesn't deliver oxygen to the body. That's where the second process comes in, diffusion. So diffusion occurs inside the tiny air sacs called the alveoli. Here, oxygen moves from the alveoli into the bloodstream, while carbon dioxide moves from the blood back into the alveoli so it can be exhaled. Think of diffusion as the actual exchange point. This is where oxygen enters the blood and carbon dioxide leaves it. The third process is perfusion. You may remember this from our previous nursing mindset. Perfusion is the delivery of oxygenated blood to the body's tissues. Once oxygen enters the bloodstream, the heart pumps that oxygen-rich blood throughout the body so every organ and every cell receives the oxygen it needs to function. Notice how these three processes depend on one another. If air doesn't move into the lungs, oxygen can't reach the alveoli. If diffusion doesn't occur, oxygen never enters the bloodstream. And if perfusion is impaired, oxygen never reaches the tissues that need it. As nurses, we assess every part of this process every time we evaluate a patient's respiratory status. We observe the respiratory rate and breathing pattern. We listen to lung sounds. We assess oxygen saturation. We evaluate skin color, the work of breathing, and overall appearance. But here's something that's important to remember. We don't treat the monitor. We assess the patient. A pulse oximeter provides valuable information, but it is only one piece of the assessment. Always ask yourself, does this patient look like they're getting enough oxygen? Do they appear short of breath? Are they using accessory muscles to breathe? Are they restless or confused? Do the assessment findings match what the monitor is telling you? That is nursing mindset. One important clinical pearl involves carbon dioxide. Many people assume that low oxygen levels are what tells us to breathe. For most healthy people, that's not true. The primary stimulus for breathing is actually an increase in carbon dioxide levels. As carbon dioxide rises, the brain responds by increasing the rate and depth of breathing. So for example, patients with advanced COPD, they can be very different. So some rely more on lower oxygen levels to help stimulate breathing. So that's why oxygen should always be administered as prescribed while carefully monitoring the patient's response. Finally, I want you to think about your nursing interventions. Every intervention has the same goal, and that's to improve gas exchange. So here, you need to think about raising the head of the bed, which will allow better lung expansion. Encouraging coughing and deep breathing, which helps keep the alveoli open and clear secretions. Administering medications and oxygen therapy to support ventilation and oxygenation. Providing adequate nutrition, which will give patients the energy they need when breathing requires extra work. Notice that none of these interventions are random tasks. Each one helps improve the movement of oxygen into the body and the removal of carbon dioxide. So the next time you assess a patient with respiratory concerns, don't stop at asking, what is the respiratory rate? Instead, ask yourself, is oxygen getting in and is carbon dioxide getting out? That single question will help guide your assessment, your interventions, and your clinical judgment. Remember, Every safe nursing decision begins with the right mindset. So keep developing your nursing mindset.